I think she was there earlier. Elizabeth, can you unmute your mic, please? Councillor Carpenter?
Here.
Trevor Rumble? Okay. Rob Davis?
Here.
Okay, I'm just trying to see where you are, Rob. Can you please put your name instead of Brantford panelist, please? Just hover over the top right-hand corner of your screen. There's 3 blue dots, right-click and rename. Thank you. Michael Bennon. James Popham.
Present.
James Uhas.
Here.
Connie McKnight. John O'Neill. Peter Zota.
I'm here.
Thank you. Peter, could you please put your name? Okay, thank you. Mayor Davis. Okay. Colleen Goupel.
Present.
Thank you. Terry Skorick.
Present.
Thank you. Heather McDonald. Kim Baker.
Present.
Thank you. Heidi Northwood.
Present.
Flora Ennis. And I'd like to also go through this Brantford City staff. Aaron Wallace.
I'm here. Hi, Betty.
Hi, Aaron. Brad Smith.
I'm present, Betty.
Thank you. Brian Hutchings.
Present.
Thank you. Julia Sipple. No. Pam Pacheco.
Hi, Betty.
Thank you, Pam. Emma, and that's it. Thank you very much. Okay, James, it's back to you.
Sorry, I was muted there. Thank you very much. So I believe we have to commence with a declaration of any conflicts of interest. Okay. None raised. 3, we have delegations. I don't believe that there are any current delegations. Please correct me if I'm wrong, but I think that currently we do not have any delegations.
That's correct. There are no delegations.
Thank you. Okay, so that brings us to point 4 on our agenda, which is items for consideration. I'd like to ask Aaron Wallace to commence with his presentation about the Community Safety and Wellbeing Plan and its status update. Aaron, I'll give you the floor.
Hi, Aaron. If you're there, you're still muted, so we can't hear you. Aaron, we actually can't hear you. I'm not sure if your mic's not working. So we can see you, Aaron. We just can't hear you. Sorry, we'll just give him a moment to try to figure out his electronic devices.
Hi, good afternoon, everyone. Dr. Popham, were you looking for me?
Was I looking for you?
Yes, am I first on the agenda? I'm sorry. I had a technical glitch there where I couldn't hear or see anything, so I've logged back in, but I know I'm first on the agenda. So I'm just logging back in and checking in with you.
Yeah, that's correct. We were right up to 4.1.
Okay, excellent. So I do apologize for that. So you let me know, you give me the signal when you want me to proceed. I just couldn't hear you, so I wanted to make sure you knew I was around.
Okay, I have yielded the floor to you, so by all means, please carry on.
Very good, thank you. I apologize for that. That hasn't happened to me yet, so I apologize. This is the first group to be subjected to that. So good afternoon, everyone. It was a pleasure to see people log in and see their faces. I know that many of us are old friends and colleagues. If we haven't met yet, my name is Aaron. I'm with the city. I'm the director of corporate initiatives. And the reason I'm first on the agenda is I just wanted to give folks a bit of a background about what this project is and what the status is, because we have been on hold for a few months because of COVID. So for some of you, this is old news, and if it is, I apologize. But I know council has appointed a few more new members in the last few months, and we know that positions change over the course of time. And so maybe there's folks on this meeting that weren't in the first meeting. So I'll give a very brief kind of status update. Then I'll pass it back to the chair as we dive into some of this the consultation and priority setting work that has happened. So I'm going to cast your minds all the way back to 2019. The province passed the Safer Ontario's Act, and there was a lot of changes that the province passed along with that act. But one of the ones that was most relevant to municipalities was they passed a law that says each municipality must have a community safety and well-being plan. So that's where that language comes from. And the province was not specific about what these plans needed to do, but they were specific about these were city plans, need to be approved by city council, but that city council needed the advice of the community to create this plan. And so initially the province had said, you guys have up until the end of 2020 to get these plans done. Now, when COVID hit, a lot of things changed, and the province has actually removed the deadline. So in regular times, we'd actually be coming to the end of this project. We'd probably have a draft plan in front of you, and it would be ready to move it on to city council in the next couple of months. But we were on that 7-month pause, reconvening today. So we don't have a deadline, but we are still tracking towards the end of next year, thinking of that as our prospective deadline. And I'll come back to that when I talk about some of the next steps in the project. But when it comes to getting advice from the community, the legislation says we must have an advisory committee. We must have a community safety and wellbeing advisory committee. So that is this group of folks around the virtual table today. And so one of the things, and many of you know Brad's the coordinator on the project. I know he's been reaching out and having a lot of discussions with everyone. One of the things we're trying to do is pick your brain, pick your data, try to get a sense of what you see as the priorities that the city can move forward. So we'll come to this later in the agenda because I want to give Dr. Popham and Brad a chance to talk back to the group about the things that they're hearing in both the community survey and in the consultations. But essentially these priorities come from two general places. There's the priorities that are already set by council. So council just went through an exercise to set its priorities for the next 2 years. And some of those clearly do deal with things like safety and well-being. And I'll talk about that when we come to the third item on the agenda. And of course, some of these things need to come from yourselves as giving advice into the plan, and also things that the community is saying. So what we want to do today is talk about those consultations, what you've been saying to Brad, what Dr. Popham's been finding in his survey, and then I'll come back on the screen and I'll talk about how we put all of those priorities into kind of one place. And at the end of the meeting today, if you're basically thinking, that sounds about right, then we're in good shape. Because what we'll do is we'll take these priorities away, we'll play with them a little more, we'll have further conversations with yourselves, we'll have conversations with others that maybe aren't around the table but would have some good insight on it, and then we'll bring back a kind of draft report to this group probably in a couple of months. And this would be essentially the advice you'd be giving to city council. So we don't have to get all the way there today. We just want members to have an understanding of what was being said, what came through in the survey, how we tried to round those things into some categories. And if that's pretty close to what sounds right, we'll get a resolution from this group for staff to continue with that process. We'll have more conversations. We'll polish it down. We'll put some rationale around those priorities and we'll bring it back to you. And if you're good with the way it looks, then that'll be the advice that, or the recommendation you pass on to City Council. So I just wanted to pause there. Again, some of that is old news to some folks around the table. Maybe it's new news if you're just joining the group, but I'll pause there if you have any questions about the project, where it comes from and where it's going.
Aaron, I have a question for you.
Mm-hmm.
I realize that there has been some discussion at the provincial level about changes to the planning regarding the law, the changes to the the public safety law. Do you have any update, or is that scheduled for later on in today's meeting?
So through the chair, we don't have an update. We are keeping up to date with our ministry officials and asking them, if things are going to change, when and what the impacts of that would be. As of right now, and I may defer to Brad if he has more recent conversations with the ministry than I have. As of right now, the only thing that's changed is the removal of that year-end deadline. The parameters of the plan and the requirement to do a plan have not changed as far as I'm aware. But Brad, maybe chime in and see and let the group know if you've heard anything different.
No, Aaron, I think you covered it right there. The last communication we received from the ministry was back in April. So that was the last thing. The only thing that mentioned was the change of the deadline. A little bit of clarification, that communication as well, but it didn't affect our plan in any way. But yeah, there's plenty of rumors out there, but nothing official in any capacity.
Thank you, you two.
Great. So if there's no other questions, Chair, I'll pass it back to you.
Thank you, Aaron. I'm just pulling up my agenda here. So I'm next up on the agenda, and I had just planned to briefly go over the community safety survey that was conducted last fall, so about a year ago. Are we able to share the slides, or is that not going to function today?
So when you need us to go to the next slide, just say next slide and we will go ahead with that.
Absolutely. So I entered into a partnership with the City of Brantford to conduct a survey of a random selection of residents of the City of Brantford. So this was limited really to individuals who resided within Brantford. It occurred from September to October of 2019, so approximately a year ago and a long time ago. The numbers were drawn from a Brantford exchange using a couple of different contact sourcing services. In total, about 2,500 calls were placed, leading to 500 survey responses. So about a 20% return on calls, which is a pretty good standard that's commonly seen in telephone polling. What that means is that we can fairly confidently say that this is going to be a representative of the interests of the people residing in the City of Brantford. Could I have the next slide, please? So it covered a number of substantive areas, in particular related to community safety and well-being. It asked for perceptions of safety, perceptions of downtown, experiences with disorder, concern about crime, experiences with victimization, if any were reported, and personal demographics. Perception of safety asked questions like, compared to 1 year ago, do you feel safe in your neighborhood? And then respondents would have a 4-point answer option. So much less safe, somewhat more safe, and much safer. Perceptions of downtown were similarly directed toward their experiences of or their perceptions of safety downtown, as well as a few ancillary questions relating to experience of disorder, things like graffiti, experiencing public drug use, other situations along those lines. Concern about crime then asked about fear of whether or not they would be victimized personally on a number of different categories. Victimization experiences was limited to individuals who had experienced a criminal victimization. Approximately 10% of our respondents, so 50 people, had encountered personally a criminal victimization, or somebody that they care for directly had a criminal victimization. And then the demographics were asking things along the lines of education, age, income, neighborhood, how long they'd lived in the community, etc. A couple of missing points here. First, we didn't have any questions relating to gun violence incorporated in this. I realized that in Brad's conversations with many of you, this has come up. In 2019, as we were composing this, the gun violence that was occurring in Brantford hadn't reached the levels that we had anticipated. As Chief Nelson said back then, that it was an unprecedented year. We also were missing COVID or pandemic response questions. This occurred before there was public knowledge about what was occurring. And so we couldn't, or we didn't have the wherewithal to add those sorts of questions. I could have the next slide, please. This is just a quick rundown of the descriptives. Basically, there was a bit of an overrepresentation of older and better educated individuals. I used a statistical process called rake weighting to adjust so that hopefully the results are a little bit more representative of what the average person residing in Brantford would be. Many of the people who responded had lived in the city for 20 years. Most were Canadian citizens, and most respondents, this slide should say visited downtown Brantford less than once a month. And I'll have the next slide, please. So a couple of the interesting points to draw from this. Most respondents felt somewhat to much less safe in their neighborhoods compared to 1 year ago. And many felt that there was some to much more crime in their neighborhoods compared to 1 year ago. Again, as we looked further back in time, 59%, so basically 2/3 of people felt they were somewhat to much less safe in their neighborhood compared to 5 years ago. And again, that 65% there, so again, almost 2/3 of people felt that there was some to much more crime in their neighborhood. Again, most respondents felt that Brantford was somewhat to much less safe and compared to 1 year ago, and most, almost the majority, or an overwhelming majority felt that there was somewhat to much more crime in Brantford compared to 1 year ago. And a similar trend again for the 5-year period. In other words, basically to summarize this slide, what we were seeing is that people looking back felt that their sense of safety had gone down. They felt less safe in their neighborhood and in Brantford as a whole. Could I have the next slide, please? On the other hand, many people felt personally safe. So most respondents, the vast majority, 97.5%, felt somewhat to very safe at home. Most also felt safe outside in their neighborhoods. So there's a little bit of a question here of the difference between feeling safe being on the streets and in their neighborhood versus looking at it retrospectively. When looking at downtown, it was about a 50-50 divide. So about 50% of the respondents felt somewhat to very unsafe. But on the other hand, 50% felt somewhat to very safe downtown. The caveat here is that only 8.2% felt very safe. So the majority of the population felt somewhat safe, but we run into some questions about what that means. When we're looking at some of the indicators of disorder, most respondents felt that loitering made them feel somewhat too much less safe. Same with panhandling and encountering homelessness. The biggest standout here was encountering public drug use made many people feel somewhat too much less safe. And this is one of the important facets of the community safety plan. So we'll be able to discuss this a little bit further as we go down the road toward developing the plan. Next slide, please. Participants were also asked or provided with a series of different crimes or criminal interactions and asked whether they felt they should be a major problem or something that the police should be prioritizing. Unsurprisingly, based on the previous slide, 93% felt that drug crimes were a big or major problem for the city of Brantford and the Brantford Police Service. On the other hand, only 37.9% felt that elderly abuse was a big or major problem for the city of Brantford. Now this, again, with elder belonging and elder experiences with criminality being something that's going to be included in the plan, this might be an area where we'd want to investigate further it seems that there's some sort of a communication breakdown here. And again, 62% felt that IPV crimes were a big or major problem. When I'm looking at the charts for these figures, for the most of them, the most commonly selected answer was a big rather than a major problem, with the exception of drug crimes, which scaled with most people responding a major problem. I can have the next slide, please. I did a little bit of statistical modeling using multivariate analysis. The frequency of downtown visits correlates with feeling unsafe. So using an ANOVA analysis here, we found that the more often people are going downtown, the less safe they feel downtown. So this is likely a symptom of exposure. On the other hand, there were some very positive perceptions of public improvements, universities and colleges and social services downtown. And in general, there was a positive correlation there with a sense of safety. So the more people felt strongly about these improvements and these changes downtown, the safer they felt. And finally, some social demographics affected results. I'm going to explore this a little bit later, but generally, as might be expected, as people age, their fear of crime and fear of victimization increases. Again, with gender, particularly in relating to crimes like interpersonal violence and sexual assault, there is a gendered difference, so women felt far less safe. Education played some role in predicting how safe people felt in the community as well. One of the things that I don't have included on this slide, but did seem apparent in the data, is that the different citizenship groups also had a different sense of safety. So individuals who were in more temporary situations, whether they were permanent residents or here on a visa, their sense of safety in the community was much lower than those who were long-term citizens. I think that's something that's going to be important when we start to consider, again, that sense of belonging element of the community safety and well-being plan. And can I have the next page, please? So looking a little bit further down the road, there's a couple of areas I'd like to explore further. I want to look a little bit more at analysis based on personal characteristics and try to develop who the fearful citizen is and who the safe citizen is. What are some of the differences in their characteristics and how that might be affecting why they feel safe. I'd also like to do a little bit of geographic or environmental analysis. So this is looking at connections between police zones and atoms, their call volume, and the sense of safety in a neighborhood. Similar things like proximity to downtown or to the 403 on-ramps. And recently I saw a presentation that was connecting neighborhood walkability and other real estate statistics with the occurrence of crime and the sense of safety in certain communities. Can I have the next slide, please? So the bottom line, I think, that we want to take away from this preliminary analysis is that there is a safety perception problem rather than a safety issue per se. People are concerned about crime and safety in other neighborhoods. They're also concerned about the highly visible forms of crime, and that includes some of the indicators of social disorder. So what you might see as you're driving through downtown Brantford. Most people in Brantford feel safe in their homes, and that's a really important point. I think we want to drive that community safety starts with the home, and this is a good starting point to realize that people are pretty safe. Nonetheless, I think there could be some room for a public education campaign based on crime and crime statistics in the city of Brantford, as well as a public education campaign on police activities to ensure and confirm to people what the scope and nature of police work is in the city. So that's the conclusion of my presentation and a general rundown of what we've learned from the city. I'll open up the floor for any questions at this point. Okay, I'm not seeing any questions. Nothing's appearing in the chat either. Emma, I think you're in control of the screen, so if you can exit, we can move on to the next point on our agenda. Okay, so next up we have Brad Smith from Corporate Initiatives. He's going to provide us with a review of the consultation process and I think some of the outcomes as well. Brad, I'll leave the floor to you.
Thank you, James. Good afternoon, everybody. It's good to see faces again. I think I've spoke to most of you on the phone in the last year, at least a couple times. So it's good to see faces again. It's a new experience lately. So what I want to do now is just quickly run through the consultation review. So what kind of fed into these priorities and kind of the framework of our plan that we have up next? Because it went beyond just those phone calls that I gave you, but I've scribbled down some notes here. First of all was the survey that was just presented to us. So that certainly that data feeds into the development of that plan. It's great. We were talking yesterday about even using it as a baseline for some of the information for some of those key performance indicators as we move forward with the plan, being able to look back at that data as a baseline. We found some of it was going to be hard to measure when we got talking about some of the priorities. So stuff like perceptions of safety that we heard a lot on there it's difficult. We don't have a ready measure available to us for a perception of safety. However, with this survey done now, we do have a bit of a baseline for that to move from. Some of the other stuff that we did there for the consultation process was we reviewed the available data and statistics in the area. So from Public Health Ontario, health units, using Stats Canada, Crime Severity Index. A lot of you received emails from me looking for plans or reports or any data that you might have available for that. So we were able to kind of plug that into our process as well. We did a scan of the safety plans across the country, actually. Although community safety and well-being planning is only mandated in Ontario, there are plenty of different municipalities across the country who have done similar types of plans. Even I attended a webinar last week for one from Oakland, where they had in the States down in California, where they implemented some safety plans as well. So doing a scan of what else out there, what has worked, what hasn't worked, and being able to take a look at that. Part of that also is a consultation with these other communities. So we've had a chance to talk to those. We belong to the Canadian Network on Municipal Crime Prevention. So that is a federal group, so across Canada. We meet at least monthly. Through the pandemic, actually, it's been almost weekly. We have some type of information or a meeting together, and we share information. We have an Ontario subgroup about that is talking specifically about community safety well-being plans. So what are we choosing as priorities? How are we doing the consultations? And being able to compare notes on that, look for some best practices to move things forward. The big one that many of you know me from is the consultation interviews. So we end up doing 23 consultations, so 23 groups that I sat down with, just about 100 people altogether in there. So some of them were one-on-one. Canadian Mental Health actually had me meet with their entire staff for a consultation, so that was a good one as well. So some points about that is, one, we kind of did a follow-up there just recently over the last month. So we did pre and post-COVID. Part of that was we wanted to see how the pandemic's maybe affected how we feel what we identified the first time. So getting that feedback on that. Not much of a shift. Some of them kind of moved up a little further, but nothing too drastic there in the comparison of the two. So from those consultations, what came out of them, I'm not going to go through all the details. Many had a phone call with me where we got to do that. If anybody would like another phone call so we can go into the details of them, I'm happy to do that. You can reach out to me for it. But we had kind of those underpinning things that obviously came right to the top of the consultation. So the substance abuse, housing and homelessness, and mental health. I've labeled them the usual suspects. We don't want to ignore those by any means. They're clearly the foundation of a lot of our concerns that came up through these consultations. And we want to make sure we're paying attention to those and we're addressing those as best we can, while recognizing that there are groups working on those within the city. And we don't want to shove those aside. We don't want to duplicate work. We don't want to step on toes, any of those. But we want to make sure that the work that we do comes alongside those, and obviously throughout the entire planning process, recognizing that those really are underlined and underpinning many of the other things that have come up. So those other things that came up, we've labeled here emerging priorities. So there are 7 of these with a few subcategories, and I'll quickly just list them off for you. But we have the downtown safety, or more so the perception of safety, came out as a theme. Violence and assault, and that broke down as gun violence, sexual violence, domestic violence, and elder abuse. We also had social isolation that came up. Now, this is the one that kind of moved up the priority list post-COVID, as more people are recognizing social isolation as a concern that people are having throughout COVID and possibly even once we're all done here. But this broke down into a couple of groups as well. Seniors, specifically youth, and other vulnerable groups such as the homeless are all suffering from social isolation, both pre-COVID and post. It's still ranked in this top 7 even pre. I would say post it moved up quite a bit as a concern that we heard. But each of those groups suffer from social isolation in a very different way. And this was a pretty broad way that people talked about, from limitations in transportation. Somebody mentioned about the condition of the sidewalks being a limitation to getting out and being social in the community. So, I mean, it covered a broad range of what we said contributed to that social isolation. Social disorder came up as well. So this was the graffiti, the panhandling, the litter in the streets was an issue. Agency service delivery, so both service capacity and system navigation for those who are using it, it can be a struggle and a limitation that we have that probably limits our ability to do the work that many community groups are out there doing. Property theft came up as an issue, as well as traffic safety. And again, that one was a pretty broad range, everything from impaired driving, pedestrian safety, speeding in the streets. So traffic safety, pretty broad, but it certainly came up as a main theme that we had there. So one of the other things that we'll do with this is, and Aaron will present next on the on how we've kind of framed these up and managed to pull all those usual suspects and the new emerging priorities all into a bit of an attack plan, I guess, if you will. And one of the things you'll notice is in this group, if you look at all of our little faces here, we don't necessarily have everybody here. So there's going to be a chance to bring other people in to work on these, working on these actions and these priorities as well as we need. Nova Vita, for example, is one that comes up. They're not necessarily here at this table, but I have been speaking with them throughout these consultations, and there's somebody we're going to want to bring in on some of those action groups and moving those forward. So don't worry if you don't see a key player sitting around the table for these actions, because there's going to be a chance to engage them. This is just the advisory committee that kind of steers that ship, and those other groups will help paddle that ship and get it to where it needs to go. So with that, I guess I'll take any questions if there are any. It's good when there's no questions. It means I did a good job at explaining it. So I'll pass that back to you, Mr. Chair. Thank you very much.
Okay, thank you, Brad. Just for the record, I did enjoy having these conversations with you and appreciate all the work that you put into putting together your summary there. So thank you for your time on this and your efforts. Pardon me. So we'll move on to 4.4 here, which is a review of priorities and next steps. And again, that's back to you, Aaron.
Yes, thank you. Through the chair. Yes, thank you, Brad and Dr. Popham, for all of that work. That's been really, really valuable as we've pulled this together. So I touched on some of this in my opening remarks, but what we want to do by the end of this meeting, if possible, and if the members are agreeable, is really just have a bit of a framework for how we want to talk about these priorities. We circulated a document a little bit earlier today that really kind of breaks down some of the categories and some of the more specific actions within those categories. I'm not suggesting that's what the plan looks like when the final plan is brought back to you, but we do want to get some marching orders from you in terms of those categories look about right, and those actions, we kind of understand where they're coming from. And so for staff in consultation with yourselves to go away and then bring something back, it's a little more built out and something that we can discuss further, but we didn't want to have this meeting without at least putting something in front of you for discussion. So what I'll do, and if you don't have that document open in front of you, the PDF document with the objectives, I'll talk my way through them so you can follow along that way. But if you do have it, you certainly can open it. And maybe I'll request, Betty, if you don't mind, just throwing that up on the screen. Perfect. Okay. So I'll just talk through them a little bit. What I want to do here is just identify where some of those actions came from, because like I said, they come from several different sources. One of those sources, as you'll see, is clearly the work that Dr. Popham and Brad have been doing to pull in that community expertise and advice and to put them on the page. And some of it is the work already being done by the municipality or the strategic priorities of council. So when council passes their priorities for the final 2 years of their term, which they did a couple of weeks ago, we want to make sure we build those into the plan as well so that they're captured in here, and that we have a holistic plan to take back to council for their approval. So you'll have to forgive me. I will be shifting my eyes here from one screen to another. But I'll just start with the category here, safe and vibrant neighborhoods. You see 5 specific actions within that category. And I can tell you that 4 of them come from council priorities already. So I'll just identify those. Council has an interest in increasing bylaw capacity. They do have an interest in putting a closed circuit television program in the downtown. There is a downtown master plan that council is committed to investing in, just reflecting back on Dr. Popham's comments about people seeing that growth and development in the downtown does have an effect on people's perception of it. And support Division Zero task force. I'll explain that one because at a glance, that might not make a lot of sense if you're not involved in that work. Division Zero task force is really focused on traffic safety. So again, going back to some of the work that James and Dr. Popham did, traffic safety came up a lot in the consultations. So here we wanted to say that council, as one of their strategic priorities, has said, we have a task force. The Vision Zero actually represents, like, the vision is for 0 accidents on our roads. And you can imagine all of the work that goes into something like that, everything from street signs and stoplights and how we organize traffic to the enforcement of speeding and other infractions. So certainly council knows that the community is talking about traffic safety. It's a huge priority for them. The one that is kind of an ongoing initiative of council, I know many of you have been involved in it, is the idea of supporting neighborhood associations. So some of these are specific to the downtown, like the downtown master plan, the closed circuit television program, and some of these are actually broadly applicable to any neighborhood, whether it's traffic safety, it's the neighborhood association work that gets done there, or it's just kind of generally building out bylaw capacity to support those neighborhoods. So I think what I'll do is I'll pause after each one of those categories, or else it's going to be just a huge breadth of information. And see if you have any questions. Again, here we're just trying to identify, I'll explain what those actions are and where they come from, either the consultation or from council priorities. So I'll just pause there, Dr. Popham, if there's any questions on that one before I move on.
It's Trevor Rummel speaking. I'm looking throughout the entire objective and actions here, and I see a significant amount right across the board. I know we're only on the first one, but it's also supporting in nature of other programs or initiatives that are currently in place. What I would believe from my own perspective to be helpful is what is the vision or strategy or terms of reference of these different programs or initiatives so that we can speak and understand how then do they fit into the community's health, safety, and well-being plan. Because over 50% of the actions are supporting the nature of different initiatives that are currently out in the municipality as it stands today.
Yeah, through the chair, absolutely. So that's something we'll bring back with the next version of this. So that's quite right. The Vision Zero task force would have specific project charter in terms of reference, as do some of these other programs. So in the more built out version, that's what you'll see is when we say something like support the Healthy Kids program. Well, what's that about? What are some of the targets in that program? How is that being measured? Where does that come from? So that detailed information is coming your way. Absolutely, for sure. That's a great question. Okay, so I'll move on to
Aaron. It's Brian speaking. Brian Hutchings. Yeah. Many of I don't know. I'm Brian Hutchings, the city manager or city CEO of the city. I come from the Niagara region, Aaron, where I was in your job, general manager, commissioner of social service for a number of years, and worked very closely with public health, hand in glove with public health. The medical officer helped Dr. Robin Williams in those days. When I'm looking at this, Aaron, I see very city foci. Like every one of these, I see the city involved with. I don't see a lot of pub, and I can say with small p, small h, public health initiatives. That's kind of the community initiatives. And when I look at I know Dr. Banky's on the phone, and I don't on the call here now, but I don't see a lot of the like baby health, child baby stuff. I mean, all the stuff that's listed that's public health does for our community, all that sort of stuff like child and baby care, prenatal, all those sorts of stuff. I don't see that in our community health. Or am I out of scope?
Yeah, through the chair, I'd answer that in a couple of ways. I think one is that this is not a complete document yet. This is a starting point, but I do think we have to be mindful that what we don't want to do is just take programs and initiatives from other community partners and just layer them onto the plan for a couple of reasons. First, the city doesn't direct the operations of those partners. And for us to say, well, we want to see improvements in X, A, B, and C programming or expansion of that might be out of scope for the municipality to build that into the plan. But no question that many of these initiatives, when we talk about, say, something as broad as a youth strategy, within that strategy, kind of going back to the last question, are a number of initiatives that public health would be in support of and collaborate with, for example, not to mention other partners. So what you do see is something that's municipally focused because this is a plan of city council. We want to be able to take action on it. Another question we get a lot is around policing. So should this plan actually have more tactical policing priorities in there? And the answer is frankly no. The city doesn't direct the tactical operations of the police, although the police have a citizen oversight component with their police services board. That's not something that we build into a municipal plan. So I would say that many of these initiatives are broad enough. If we look at the first one, like Healthy Kids, we've been lockstep with public health for years on that program. But what we're not doing is inserting particular programs or initiatives of other community partners. And creating a sense that this plan is driving that action. But it is a good question. It is something that needs to evolve in the plan as we go, certainly.
So it just helps me with my scope on it. So this is a city community safety and well-being plan, not a community safety and well-being plan. You said that we only put in things, the council will approve this. So we're only putting in things that the city can kind of control and operate versus the community.
Yeah, I think there's two pieces. There's things through the chair. There's things that city controls and operates, no doubt. And there's the things that the city supports. So when we come to the priorities like substance use and those types of things, which are more clearly the mandate of other partners that have that expertise and that direct line of funding, then the framing within our plan would be we'd support those things, but we wouldn't necessarily lead or drive the action on those things. And that's, again, out of respect, as Brad said, about this isn't a plan that's about this, wants to step on toes and kind of make it appear as if the city's directing actions that are out of its mandate. Directions that are within our mandate, we want to do those things as well as possible. Where there's a chance to step out of our comfort zone or step into new initiatives and support the community where the leadership is, then we want to do that as well. So I'd say it is a community plan, but it is seen through the lens of city council, the things that they would fund and support and that are within their mandate. And the other side of that coin is, so it's not seen by community partners as being something where we're trying to overtake or overstep our role as a municipality.
Okay, great. Thank you.
Aaron?
Yes.
It's Peter. Aaron, for me, this last couple minutes of conversation spotlights the distinction of what the city is responsible for and drives, and a couple of those other items, that distinction isn't made clear enough in the document. Perhaps it's a simple way of formatting it and language to make that distinction.
Oh, through the chair, I would agree. Yeah, there's some work to be done on the language if we generally have a sense that these are where the priorities came from, and this is the marching orders to build these out more. You're right, language will matter here because there may be times where it's phrased in such a way that it's not entirely clear who's on first, but that will be fixed before the final version for sure. Yeah. So Dr. Popham, did you want me to carry on with the other categories?
I believe that time permits.
Okay. Okay, so we go to children and youth. That was a lot of the consultation, a lot of the feedback was around that engagement of children and youth. So some of these things, again, are city-specific initiatives, again, that have partnership components, but are driven by the city. Things like early on centers, the Healthy Kids program, Together for Youth, the youth strategy. Invert my eyes here as I scroll down. I've got the wrong mouse in my hand. Okay. One of the things that was brought forward pretty consistently, as we heard, was around gangs, guns, and violence prevention. And so again, this is a great example, going back to our discussion just now about where does the city fit within that scope. So the city's not going to direct the operations of the police in terms of more resources into gangs and guns. That's something that has to happen within the police strategic plan and within their operations. But what I think the city can do productively is be very specific around programs that look to find youth that may be susceptible to getting into gangs, and how we do some of that youth prevention work. So you see that captured in there. Again, language isn't perfect yet, but if you talk about supporting youth violence prevention initiatives, that's where our mind goes when we think about what is the city's role when it comes to that broader spectrum of gun violence and assault and those pieces. This is the first one here, number 5 under children and youth. We start to name specific other groups and organizations that do the work. So when we talk about children and youth, we want to honor the idea that there is really good work happening through the Best Start Network, which is focused on kind of little kids. And there's very good work happening through kind of the Strategic Youth Leadership Table, which is a collaborative of agencies that have a mandate for youth. So this is one where the city's not saying, we have our own internal youth strategy and we kind of drive action in terms of how we find youth and support them. We know there's other agencies like Woodview and others that do a lot of work on youth, have a lot of expertise, where we want to slide into that conversation is how do we best support the efforts and the goals that are coming out of that. So the next document you would see, if this is something that you want to see explored further, is we would build out some of the understanding of what those groups do. So we talk about their terms of reference, their goals, their mandate, and where can the municipality fit in. So that's the 5 for children and youth, and I can pause there.
Hi, it's Trevor again. I listened to what Brian was talking about, and where I come back to is, what's the mandate of this specific group? And to me, in the most simplistic of terms, it's, a sustainable community through evidence-based programs, and it's those programs that then support the sense of belonging, access to programs and services. So I think while we're reviewing this, I think really everybody needs to keep focused on truly what is the mandate of this particular group and what we're trying to deliver for the provincial legislation requirements.
Yeah, certainly, I'd certainly agree with that. Yeah, those are good points for sure. That is, the end result is how do you put more programs and initiatives on the ground, either by expanding their reach or just new work that addresses those priorities. So that's, yeah, absolutely right. Yeah. So we look at the age-friendly components. So a number of these come from the existing council priorities. So things like the existing healthy aging plan, those programs within that, like the elder abuse strategy and the Let's Get Moving campaign. So here we're saying that council has already an existing priority to reach more older adults, especially through recreation and in support of reducing social isolation. So these are clear initiatives that we can expand, potentially look to council to fund further if that's an interest of theirs, or we can look for grants or other sources of revenue to build those out. We talk here about the Beckett Adult Leisure Center, which is the senior center downtown. Some good discussion about how we can expand the reach of that, particularly into things like seniors housing sites. So for folks that can't get to the leisure center, but still would benefit from some of that work, how do we get the leisure center kind of on the road and out to meet some of those folks? So those are all priorities of council as it exists now. And here again, in this category, we want to name some of the expertise in the community. So here we're talking about supporting the efforts of the Grand River Council on Aging and the Elder Abuse Prevention Committee. The city's kind of closely tied to those groups. Again, those groups have their own strategic plans and their goals. The city's not necessarily trying to lead those groups, but we do want to be in support of them. So we come to diversity and inclusion. The city has an immigration partnership. I know many of you are on that group and a part of that work. So that's already a kind of a baked in priority of council. We heard a lot in the consultations around the experience of international students. So international students are slightly out of scope for the immigration partnership. That's why they're listed separately here. But we do know that international students are a group that we want to be thoughtful about in terms of how welcome they feel, their experience when they come to our city, and what they can offer in terms of vibrancy and diversity and economic development and all of those pieces. So that's broken out as a separate category. We know the city has a strong ongoing relationship with the Indigenous Friendship Center, and there's probably lots of opportunity for growth there. And so what is some of the things the city can do to create awareness of that program, help support that program, and build that out over time? And then here, a very tactical one and something the city could be doing fairly easily is kind of support the translation of community documents. So we have a leisure guide for our recreation department. We have tourism information. What is support the idea of diversity and inclusion if we were to translate that into Farsi or Arabic or Spanish or whatever the predominant non-English languages are in the community. So that's why those are broken out into those separate categories. Dr. Pop, I'll just pause there again in case there's any discussion on those.
Thank you, Aaron.
So hearing that, I'll just talk a little bit about affordable housing. Housing and homelessness came up as a significant priority. And so here, again, we want to tie in existing work of the community. And this kind of goes back to to questions earlier about like who owns the plan, some of these actions are clearly owned by the municipality, and some of this work and the goals within it were built by the community already. And so the Mayor's Housing Task Force is a good example of that. Now, this is a bit of a preview because that thing hasn't been completely finalized by that task force yet. But by the time this was to get to City Council, if you want to include this in your advice, that would already be signed, sealed, and delivered to Council. So by way of a bit of a preview, essentially what the Mayor's Housing Partnership Task Force wants to do is say, look, as a community, we need to build about 750 units over the next 10 years just to keep up with population growth if we want to have the same percentage of affordable housing units as we currently have. Which isn't a very aspirational goal. That's just keeping up with population growth. And if we want to get ahead of the curve and start reducing those wait lists and giving people a place to live that they can afford, we probably need to build, say, 1,000 units over the next 10 years as a community. The municipality has a goal to build 500 of those. Obviously, the other 500 are a combination of nonprofit community housing providers, private sector, whatever that needs to look like. So going back to some of the earlier comments about what are the goals and actions of these things that are baked into this, what we'd be saying in this plan is this plan also is inclusive of the idea of affordable housing, but we're not going to build out an entirely separate affordable housing plan. The Mayor's Task Force has done that. It's already brought the partners together. It already has goals and a number of action steps that have been approved by Council. So that was a bit of a long and winding road about the Mayor's Housing Task Force, but that's why you see it in there. We know affordable housing is a critical need. That's been recognized. Work is underway. And I think by the time this hits Council, some very productive work will have been done in terms of finding that money and land and some of those resources that are needed. That's why that exists there. The other piece there is about shifting municipal investment to long-term strategies. So this is something that we've talked to Council a lot about. In traditional ways of thinking, there's lots of investment made in emergency shelter beds. And those need to be part of your system, but they're not the most strategic investment you can make. You need to be thinking more about affordable housing, like we talked about earlier, or supportive housing, rent supplements, the kind of things that give a person a more permanent place to live so they can work on some of their challenges if such challenges exist. So that is why that is there. So there's a Mayor's Housing Task Force talking about the building of more units so the community has them. And then there's this broader idea about how the municipality can shift this investment into more long-term solutions but somewhat apart from more investment in emergency sheltering. And so here on number 3, we see a reference to the first reference to the Ontario Health Team. And so the reason it's there, and again, this is something we can play with and make sure, I know a number of the folks around the table here are a member of that health team, so we want to make sure it's represented properly, that we know one of the priority populations for the Ontario Health Team is how you reach homeless individuals and make sure they have the supports that they need. So those things all kind of go together. The municipality wants to focus on getting a roof over people's head and making that sustainable. And of course, that health team wants to make sure those folks are healthy and well in their personal journeys. So that's why that's represented there. So I'll pause there on the affordable housing one again, just for any questions or clarification.
So Dr. Northwood, would you like to ask your question now, or would you wait till the conclusion?
I'll wait till the end of after Aaron goes through the substance abuse. Thanks.
Okay, and Peter?
I'll wait also, thanks.
Okay, thank you. Aaron, I just have a question for you relating to the affordable housing component here. Looking at the long-term outcomes of this activity, would this be including things like petitioning for additional funding to support some of the proven initiatives that already exist in the city, or is this more of identifying future opportunities for improvement or programming?
Yeah, through you, Chair, I think it's both. So the Mayor's Task Force is focused specifically on where is the money and the land and the partnerships to actually build, just the shovels in the ground kind of partnership. When we broaden that out to what are some of the strategic initiatives that support individuals who might experience housing, precarious housing or homelessness, then it is all of the things that you said. It's advocacy for new programs. It's potentially redirecting current resources over a number of years away from more emergency response and towards more long-term response. So I think it can be both those things. It can be things that are purely kind of the meat and potatoes of building affordable housing, but it also can be how we think differently about how that investment goes.
Thank you.
Okay, so maybe I'll just bring it home here with substance use, then we can open up the questions on any part of this or any other places that this group wants to take the discussion. So in substance use, there's kind of 2 actions here. We know this was a huge topic of conversation in the in the consultations. And here again, trying to kind of center this plan so it's not overstepping other groups that are doing this work productively. And so the first here was action from what was the Drug Strategy Advocacy Committee. So some of you sit on that group with Mayor Davis, and one of the marching orders from that group was for the city to work with public health on something that was kind of a large-scale youth drug prevention initiative. So we've stuck that in here. I can say due to COVID, there hasn't been a lot of work apart from background work on that, but it's still on our work plan and something we're willing to move forward with if this group thinks it's still a piece of that work. And then there was the last one here, support community partners in the implementation of the drug strategy. So again, some of you have been a part of those discussions and that work for a couple of years even. And so the idea here is that there's places within that strategy that the municipality can be very effective, whether it's communications or advocacy or on a project level. And so as that strategy comes into focus, and I think there's a lot of work on the Ontario Health team about how that integrates with some of the work they're undertaking, then the municipality needs to be standing by to take up its pieces of it and do that work. So that's what that represents there. So I'll pause. I think do a double check here. I think I got to the end. But happy to take questions on any of that, or if you want to have discussions with other members, certainly I can stand down and let those discussions happen.
So congratulations on making it to the end there, Aaron. I will open up the floor first to Heidi, who had the first question. Following up, we'll have Peter.
Thanks, James. This is Aaron. This is a question about the, 7, 1, 2, 3, 6 objectives. And excuse my ignorance if I should know the answer to this. Are these 6 objectives, were they devised in order to take account of all of the initiatives and the information that was gleaned through the survey and the consultations, or are they fitting into an already existing framework?
Yeah, through the chair, it's the first one. So these are the categories that broadly would cover information that came through the consultation, but also things that have already been approved by council that would be in scope of this plan. So there is no existing kind of 6 pillars of city government or any of that this is being built into.
Then I will congratulate
So
you.
those can be adjusted.
Yeah, I think what it does really well is to actually bring together then all of those things. One thing that I'm not sure how this is going to look in a final plan is that I take it that there will be sort of preamble that leads to a summary of the surveys and this survey that gets at some, like, I think what's really helpful is the 7 emerging themes and thinking about that in conjunction or overlaid with James, your work with the survey data. I guess I'm just wondering whether there's a way of actually making it clear how each of those emerging themes as well as the data actually is covered by these 6 objectives and the attendant actions.
So certainly some of the answers that are coming from the data that we've collected through the survey are going to be directly applicable. In other cases, not so much. The survey that would have gone out last October was primarily directed toward the community safety element rather than the broader community safety and well-being element. I have been communicating with Brad and Pamela regarding how we can answer some of these questions and also identify additional questions based on what's come from the survey.
Thank you.
I hope that answers your question.
Yeah, I think it does, and I think it seems. I think the reason why I asked the question. Sorry, is my audio really weird?
Coming in fine here.
Okay, good. So it's just a weird. That's fine. Good. It seemed, I guess, the reason, the motivation or the impetus behind my question was that it seems, James, that a lot of the information that you're getting could lead to very specific and very, very specific strategies that could try to, make things, more positive in this perception or that perception. So I think the question really, I think that I'm having is how then will that data be used in the implementation of any of these actions that are relevant. And I guess, yeah, I think that is my question.
Certainly, thank you. I think we can identify, as I mentioned during my presentation, how to better address these concerns. So the survey that I conducted is, in principle, a public opinion poll. And it's identifying, in my interpretation is that it is identifying questions that the public might have or information that the public may not have reasonable access to about safety in the community. And I think that we can pair those gaps with what has been presented by Aaron and developed by his team here to identify how we can answer those questions, or how we can use the information presented here and pair it with the questions that are raised by the survey. Yeah, those are my thoughts. Okay, if it's okay with Heidi, we're going to move on then to Peter, whose question is up next.
My question would be an extension of the discussion regarding items that have the main drivers through other accountabilities. For example, you've got the Ontario Health Team item there around homelessness, and you have the community partners working on the drug strategy. If when you include those items, is there therefore a desire or an expectation that folks who are leading those initiatives should be engaging with this committee for advice and consultation? And it's a selfish question. I'm deeply immersed in both of those, and then it gets a little foggy what the expectation is in terms of interfacing with this process.
Yeah, so through the chair, I think if this was the marching orders from this committee was to more fully explore this, then that would be part of Brad's role, is to reach out to those various groups and say, you know, this is a discussion point during the community safety and well-being planning. We think that obviously the leadership belongs with this external group, but there may be a role for the municipality. What's that going to look like? So that would absolutely be a part of the discussion. I think what this would do, and let's use the kind of the Ontario Health Team's priority population of homeless individuals as a concrete example. I think what this would do is kind of bake in the idea that the city has a responsibility and marching orders from its council to fully participate in helping that Ontario Health Team find and support those individuals. So right now, not to say that that's not happening, but this would be a clear and present direction to staff to say, this group has leadership on the primary care and supportive care for those folks. You have access to those folks as city staff through your shelter system or other services. It is an expectation now of your council that those two things work well together. How they work well together is, I think, where your question is important. And I think that's work that Brad, or in this case, Kevin O'Hara, as our manager of homelessness, would really dive in and say how those things intersect. So this plan essentially would say, there's probably some work that should be happening together. Council directs you to make sure that happens. And then on the ground, it would be direction to our homelessness team to work with that Ontario Health Team to make sure that's happening productively.
I mean, my only final comment would be on both those bullets on the sheet, like the work is happening now, and the timing is good sooner than later to nudge us and give us advice.
Yeah, we can. Yeah, we're standing by. Like, we're ready to have that discussion. I know Kevin O'Hara is heavily involved in the OHT work in terms of homelessness, and our communications director is heavily involved in that drug strategy work. So those linkages are there. But yeah, if this group feels that as a starting point, this is something to be explored in terms of building out the full plan, then it would be kind of Brad's role to reach out to both internal staff that are connected to those groups and the external groups themselves to figure out what this should sound and look like. And sooner than later is what we're thinking too.
Sounds great.
Hi, everyone. It's Kim Baker. I just wanted to, if I may, just follow up what Peter was saying, because I too am pretty heavily entrenched in the OHT and the drug strategy work. And I think what you just mentioned, Aaron, is an important point. I mean, the OHT and the drug strategy committees are not interventions that are going to advance your communities, that are not going to advance in and of themselves community safety and well-being. So I think there's a necessity to identify the interventions being discussed or implemented within those collectives that may advance community safety and well-being. And there's a very, and I would suggest the same for something like the Child and Youth Strategic Leadership Table, which I'm also a part of. You know, those committees, those tables, those processes may not have a direct impact on the outcomes related to community safety and well-being, but specifically identified interventions might. So I guess in general, what I'm saying is, you know, there's some, I think it would be helpful to have a greater level of specificity about intervention and intended outcome as it relates to some of these items.
Aaron, we can take that under advisement for when we have an open discussion about future steps.
Oh yeah, through the chair. I just didn't want to jump in after every question and say something because I know that members want to talk to each other, but more specific is way better for us. So if there's an opportunity to dive into that category and come up with 2 or 3 specific things, that's perfect.
So Dr. O'Neill had a question. Sorry, Kim, have you? Okay, so we'll move on then to Dr. Have we lost him here?
Here, I'm still here.
Oh yeah, okay. I couldn't see you.
Lost you on you. I just fell off your screen. So.
Yes.
So my feedback would be, I think all the categories are probably good categories in terms of the notion of safety and well-being. So I think we've really hit the categories well. I think I'm a bit where Brian is. I'm not sure if this is a city plan or a community plan, and maybe it has to do with the lens at which we all come to the table. So I think if we're coming with a sort of a collaborative framework around which we say that organizations are coming together to commit to a community safety and well-being plan and will collaboratively govern that plan, then I think it has a different lens in terms of language. And maybe that will inform my next question, which is some of the words around improve and support. When it gets to words like support, I'm not sure that clearly understand what that means. Getting some feedback. Something must be
sorry, just a second here, David. I apologize. I've noticed there's a bit of feedback coming in through your mic. So if anybody has their mic open, would you please mind muting while David is speaking? Thank you.
Yeah, so I think the other question that, really I had was then, some of the language around improve and support. I think I don't know what support means. If support means there's an investment, if support means, yay, we're behind you, or if support means we're actually going to allocate resources. And again, it's the lens of, is this a community plan or is this the city plan? I would advocate that if we're going to really make this a very effective plan, that we remove the lens from our traditional governance, that this is a city plan and this is our job to do, to a much more collaborative governance model, which says this is something that we're all committing to do, and we all have sort of skin in the game and trying to effectively implement it. So those would be my comments. I think you've done a great job at hitting the categories. If you want to get into some detail, I think there's a lot of overlap between the aging friendly community. It seems to be some, from an uninformed individual, when I read it, it looks like there's a lot on preventing elder abuse. 2 major initiatives. And I'm not sure what some of the other, what it means to improve access to the leisure center. I don't know what the outcome that is trying to achieve. So maybe that would be my only comment in terms of anything specific.
Okay, thank you, Dr. McNeil. Next up, Trevor has asked to have a comment.
Well, we've been walking through this. I think for me, one of the missing pieces, it really comes back to the grassroots to the community. What is the plan for communication? We have all these initiatives, these different programs, but unfortunately, a lot of residents within our municipality don't know what's available to them until they need something. So I think trying to tie everything back together, supporting the different initiatives, really needs to be an all-inclusive communication plan to support all of the different programs and initiatives. I think really that should be also part of the objective of this mandate.
Thank you, Trevor. I believe there is some conversation about improving that communication, but I think that's a very important point, something that we've observed both through this research and I've observed in past research with different community members is the lack of, or I shouldn't say lack, but challenge locating information about what's available and what's occurring. Chief Davis, I believe you have a statement or a question you'd like to make.
Yeah, can you hear me okay?
Yes.
So it's in line with what Dr. McNeil said. When I look at the 6 categories, when we talk about diversity and inclusion, Brantford is uniquely situated because of our geographical location, being right next to the largest reserve in Canada based on population. And we live in the era of truth and reconciliation. And so I struggle with what does support mean. When you look at the diversity and inclusion piece, and we have BIP, we have support international students, and then tucked in there, number 3 is the Indigenous component, but what does support mean? And so just given the realities of our location, the dynamics going downriver 20 kilometers, and really across Canada over the last couple of years, I just struggle with, is there even if we were ever taken to task as a city and any of the leaders in the organizations in the city at some point, did you even consider 6 Nations? Could we answer that? And it just echoes what David said, like what does support Brantford Indian Friendship Center mean? So just a comment, I'm not sure if it came up or if it's completely lost in the people that were surveyed, but it's my 2 cents.
So in the survey itself, this was a random sample of individuals who are residing within Brantford. We certainly did have some people who identified as Indigenous who provided responses. And we can take a deeper look at their specific responses. The questions themselves were not framed to be specific to any one community or any community's interpretation of things that were occurring. On the more qualitative side of things, which Brad took the lead on, I believe there was quite a lot of dialogue about this. Brad, if you're still present, can you add anything to that?
Yeah, I think I would just say through those consultations, unable to join us today actually, but still a member of this committee is Connie McKnight from the Aboriginal Health Center. So we are getting that kind of input there. And how we'll approach that number 3. We mentioned earlier making sure we pull in the right partners for the right actions and the right priorities there. So certainly when looking at diversity inclusion number 3 there, what support looks like will certainly be a big discussion with that group, pulling in any other subgroups that we can find there to help address those specific needs and actions there. So I think words like support and implement and expand on, I think those are the words we need to build out on and find out exactly what that does mean. What does that mean to those groups? So what does that mean to the Indigenous Friendship Center? If we say we want to support you, what kind of support are we looking for and how can we expand that?
Super, thanks.
Chief Davis, do you have any follow-up questions or anything else you'd like to state?
Nope, that's good.
Okay. I don't have anybody queued up for questions through the chat function. Is there anybody else who would like to speak, make any questions or any comments? Okay, I think there's always going to be the opportunity for follow-up. I would encourage anybody who may have any questions about the survey component to please contact me. My information was circulated as part of the email that went out from Betty earlier today. It's jpopham@wlu.ca. Same with Brad. I'm sure you've all had conversations with him, and I know he has an open virtual door for anything you'd like to speak to him about further. With that being said, that moves us all along in our agenda to point number 5, which is a review of the minutes from the last meeting. Has everybody had a chance to review the minutes? Betty, have they been made available to the committee?
Yes, they, there was a link sent out in the email this morning.
Okay.
So we will just need a mover and a seconder to approve those.
Okay, so I will make a movement to confirm the minutes from our previous meeting. Kim, you're nodding your head. Are you going to be my seconder here? Okay, thank you, Kim. Okay, do we need to have an open vote for this, Betty?
Sorry, I just had to unmute. Yes, we do need to call a vote. If you could just have everybody maybe raise their hands.
Okay, so all those in favor of approving the minutes?
Okay, passed.
Okay, thank you very much. So that leads us, sorry, I've just muted myself. Are there any resolutions to discuss here, Aaron?
Yeah.
Hello? Oh.
Dr. Popham, can you hear me now?
I can.
Oh, okay, I'm back with you. Okay, so maybe it might be useful if the members are in agreement to set a date or at least a time frame for the next meeting. And you may want to consider a resolution of the group or a motion of the group to send us back as staff to fully build out and answer some of the questions of this advisory committee. So lots of questions around, well, what would be the kind of the secondary layer of consultation if indeed this plan was going to incorporate some of the other group work happening? What are some of the definitions around this work? And then what we could do, I'd suggest, but open, obviously it's up to the members, maybe to come back in a couple of months with something that's built out to Ms. Northwood's question about how do we directly tie some of the data and consultation findings to these objectives. That's work that would happen in this next step. And so we'd be able to come back in a couple of months with those questions answered, with a document that's a little more built out around some of the feedback around if we're going to reference other groups and work, what are the goals and actions of that group? Those are all fair questions. And we knew we weren't going to explore all of that today. We just wanted a general framework as a marching order to take it away and build it out. So those two things potentially at your discretion, Chair, to talk about a timeline for a next meeting and to send staff away to answer the questions and build out the pieces that need to be built out.
Okay, so I might recommend breaking that up into 3 motions. We will talk about the motion for a new, or our second meeting or follow-up meeting up shortly here. In terms of, resolutions relating to the plan, I think it would be in our best interest to, one, have a resolution that accepts the draft that's being sent around and expresses that the department moves forward with filling out the filling out the plan with more detail. And then the second one might be having some window of feedback via email or electronic communication that members can contribute toward it. Are people in agreement with that, or am I being too excessive here? Okay, so I will then raise motion for the first point there, that the first resolution, that the pillars of the plan be accepted and that the department be advised to move forward with building up the community safety wellbeing plan based on that information. So can I have a seconder, please? Colleen, thank you. I believe again this will need to be a vote. So if you're in favor, would you please raise your hand so it's visible to the camera? Okay. So I believe that's accepted. The second motion then would be to have a prescribed time frame for members of the committee to submit their feedback on the plan. I think it should be going directly to you, Brad, correct?
Sorry, through you, the chair. Yes, I can certainly be the point person for that. So if there's any additional feedback or any suggestions, questions, quandaries, those can be sent my way.
Okay, what's a reasonable time frame for you, Brad? Would 2 weeks be enough, or too much, or too little?
That sounds about right. That'd be good.
Okay, so 2 weeks from today puts us at the 11th of November. So I guess my second resolution here then would be to have a window of feedback, or an opportunity for feedback from the council, or sorry, from the committee, open to communicate with Brad until the 11th of November. Do I have a seconder for that? Dr. McNeil, thank you. Okay, those in favor, please raise your hand. Okay, thank you very much. That's been approved. I don't believe that we have any notices of motion that were submitted to us, so we will skip over number 7 here and move into number 8, which is to plan for our next meeting. At Aaron's advice, he's suggesting 2 months from now, which puts us into December. While I'm certain that the current pandemic has affected our personal plans over the holidays, I would recommend that we still plan for earlier December rather than later December, or alternatively January. I'm not sure what the best process here is for establishing those dates. I guess I'll open the floor. Would people prefer early December or early January? Indifference? No trips to the Bahamas?
I'm utilitarian, James. It depends on what your timeline is to move the next steps along. If we're providing feedback to Brad by November 11th, would that feedback be integrated by early December, or would there be a requirement for more time to do that?
Through the chair, with my mute on, I've been sitting here saying early January, please. My preference would be early January if that's possible. However, I'll work around you.
All right, then I'll move a January meeting. I think we will speak about the date in vague terms so that we're not specific to a window, at which point then we can have a doodle poll or similar tool circulated to everybody to choose an appropriate date. So I'll make the motion then for an early January meeting. Can I have a seconder on that? Thank you, Councillor. All those in favor, please raise your hands. Okay, thank you. I believe that's been approved. And then the last point then here is to have a motion for adjournment. So again, I'll make the motion for an adjournment and request a seconder. Thank you, Terry. He had his hand right up. He was ready to go. So all those in favor of adjourning? Okay, thank you, everyone. So that concludes our meeting. Thank you, everybody, for attending. I was happy to see all of you, and hopefully we'll have a chance to see you all again soon. And again, as a reminder, please do not hesitate to contact me with any questions regarding the survey, or Brad with any other conversations about the plan. And thank you, everybody.